all. We're protected. We're good to go.
More local news now here on Live at 12:30. This week marks the National Infant Immunization Week, and with recent outbreaks that we've been talking about here on the news of whooping cough across the area, many parents are concerned with how to keep their children healthy. And joining us today with some of her insight is Dr. Margaret Hennessy from Wheaton Franciscan Healthcare. And Doctor, I understand congratulations are in order as well. You just received an honor from the CDC for being a champion of immunization.
Childhood immunization champion for Wisconsin.
Champion? Wow, did they give you a medal or something? Right, they should. Well, congratulations on that, and obviously it's an important topic. Can we just talk about, I was just telling you here, you know, I have 3 little kids, and since we have regular visits with our pediatrician, it's not even something we think about. You take them in, you say, well, this week we're having this, that, and the other. How are you finding that parents are not somehow immunizing their kids?
There are still people that don't come out to the doctor's office, and I think there's also people that are afraid of the financial burden of coming to the doctor's office. The fortunate thing for children here in Wisconsin is that we have a program like the rest of the country called Vaccines for Children. The program essentially would cover vaccines for children that don't have insurance of their own, or if their insurance does not cover it. The other option people can always have too is going to the health department, where there's little or no cost to vaccinations.
Well, certainly for health officials it's a value to them as they try to look out for the whole community
Sure.
to get as many people vaccinated as possible.
Absolutely.
Let's look at specifically whooping cough. How are we doing on that? I mean, I know my kids have been vaccinated, but that doesn't mean they won't get it necessarily.
Right. We're certainly seeing an increase in cases. Since the beginning of this year, we've had over 1,000 investigations in the state of Wisconsin related to that, and that's about 10 times as much as we had last year at this time. So there's definitely an increase. Pertussis, which is whooping cough, tends to have a cycle, so it does tend to have natural peaks to it. The hardest thing about whooping cough is that if you get the disease or you get the vaccine, you don't have lifelong protection to it, that you can get it more than once. It's also a very hard disease to track because early on it can look like a cold virus. Sure. And often we don't find out or figure out that you had pertussis until you've been sick for a couple of weeks.
We have virtually no time left, but I want to make sure I ask you this question because one of the reasons that some parents don't vaccinate their kids are fears that have been brought out about the connection between vaccinations and disorders such as autism. Is there any medical connection that you're aware of?
Absolutely not, and this is studied and studied and studied. We're not worried about autism. We know it's a genetic disorder that has nothing to do with the vaccines.
Well, good, and we'll keep getting that message out for you. Thanks so much for being here. Congratulations on your award as well.
Thank you very much.
All right, well, the state has set up a database. It's called the Wisconsin Immunization Registry, where you can check on your child's records. Just head to the link section of today's TMJ4.com to do that.